Tuesday. We're excited to have you all here. Welcome back to those individuals who have been with us previously. And then, of course, welcome to any new individuals. You'll notice the slide up here. This is kind of our quote that I love to use, that education is learning what you didn't even know you didn't know. So I think that just really sets the stage for our work as part of HOPE. And then kind of a new thing that we've been able to create, so I want to pull that slide up for you, is I think it's going to be really important for you to have the opportunity to access either today's presentation or any previous HOPE presentations. So we've put together just a really easy opportunity for you to do that. There's two things that you can do. The first one, if you're comfortable with the QR code, you'll see that up here in the slide. You can literally take your camera on your phone to that QR code, and it will pull up a link for you and take it directly to the YouTube page that offers all of the videos, previous and the ones that will be coming up. So that would be one opportunity. Or you can just go ahead and copy down this website, or again, take a picture of it with your camera. And then when you put that website in your URL, it will bring you to this white box, and you'll see HOPE, Healthy Options for Prevention Excellence. If you click on that, again, it will take you to all of the previous recorded videos. So wanted to let you know just an easy way to find things. It's so awesome sometimes to be able to go back to things you've learned previous and have that ability to pick up new concepts. But also, right, just if there is a day that you're not able to join us, it doesn't mean that you have to miss all of this great material. So just wanted to let you know that was in place for you. Just as a friendly reminder, the call will be recorded today. Just as part of the conversation with Dr. Desai, once we get to questions, we'll go ahead and stop that recording. And then we love hearing your feedback. So please make sure that you utilize the chat option and put in there any questions you have, or if there's something that we need to slow down or refer back to. Please know that we want you to use that. I'll be watching that the entire time as we go through. And then I always love for you to use that chat box just to put in your name, where you're from, and what brought you to HOPE today. Any other thing that I should be sharing with Dr. Desai?
No, this is great.
Okay. Well, I would love to at this point go ahead and turn it over to Dr. Desai. So as you know, he's going to be speaking today on exercise, dementia prevention, and brain health. So I will let Dr. Desai, you should be able to share your screen now and take it over for us.
All right, 1 second. Can you guys see the slides?
Yeah.
All right, fantastic. All right, so hi everyone, and welcome to our third Healthy Options for Prevention Excellence sessions. Today we'll talk about physical exercise, dementia prevention, and peak neurocognitive health. So disclosures involve the book I wrote, and I'll mention why this has some information that might be interesting. And then mindfulness is a good way to also involve that in exercise. So that's another resource. The learning objectives are to describe research regarding the role of exercise in reducing our risk of dementia. So reducing risk means either not having dementia or delaying the onset, and also research on improving brain function. So just that's an overall term, brain function. Uh, Brain is more than just cognitive functioning. Then another objective is to explain why, if you're interested in peak neurocognitive health, then why again exercise is really essential, and then how to make this happen. What are the practical strategies to make moderate and vigorous physical exercise just our everyday part of life. I would urge you to consider going to this website, Wisconsin Alzheimer's Disease Research Center, and see if you want to sign up for this. It's coming up. It's quarterly sessions, very highly rated speakers and organization, and it will give you other speakers who will say the things we are talking about, which is how to harness the power of lifestyle intervention. So, exercise is one of them. And what are the tools that can encourage personal motivation? So, how do we motivate ourselves and our family and friends and colleagues and the wider community? The way we talk about four vital signs: heart rate, blood pressure, respiratory rate, temperature, and now we talk about fifth vital sign like pain. You can ask, check for exercise vital sign. How often do you engage in moderate to strenuous exercise, and how many minutes? Uh, Maybe as a routine part of all uh, healthcare visits. If you are the patient, then you can start this conversation with your primary care. Again, the basics: exercise is more than just brisk walk. That's aerobic exercise where you increase your heart rate. You want to also strengthen your muscles. You also want to be more flexible and increase your capacity for balance and reduce falls. Uh, we should all know, so all this is brain health literacy and exercise literacy, that when we say moderate intensity of exercise, it means that we are doing brisk walk, but we won't be able to sing during that walk, but we can talk. And if you are running, which is different from jogging, jogging would be considered, say, moderate intensity. And, and if you're running on a trail or on treadmill, then it'll be hard to even have a conversation. And again, now we know that we should at least strive for this, perhaps even more. 5 days a week, 30 minutes a day of moderate intensity exercise to your target heart rate, and then again, vigorous intensity. Again, we don't know the exact research wise, and unless you guys know, let me know and share it in the comments. How much exactly the research shows is the amount of strength training one should do. I would say 20 minutes twice a week at a minimum, perhaps even higher. And again, we need to all make it very tailored to our strengths, our abilities, and sometimes we might need input from physical therapists, our primary care, so that we do it in a very structured manner with specific goals, the SMART goals, so that we can track how well we are doing it. This is just a side note. I haven't delved into the details of how they figured it out, but apparently Utah is the healthiest state and Idaho is 16th. 16th is not bad. And when I talk about peak neurocognitive functioning, I talk about these six domains. So again, when we talk about cognition and dementia, we generally talk about memory loss and Alzheimer's, but that's just one of the neurocognitive functions. So again, there is attention, then there is complex attention, social cognition, how well we can understand other people's perspectives would come there. Perceptual motor is where we have like visuospatial memory. Uh, my wife remembers the the places we go to by memory, even though she doesn't know the names of the streets. Executive function like planning, ability to switch to a different uh, topic, hindsight, foresight. So that's all executive function, the CEO of our brain. Language, so again, word finding difficulties would come in here, and actual difficulty comprehending. One has to be sure that it's not due to hearing deficits. New learning, so some of this, what happened today, could be considered new learning, uh, but in reality, new learning is actually something like a skill. So if you're learning to say dance, ballroom dancing, or a musical instrument, that would be new learning. We do that like very intensely in school. That's why that secondary education is so important as dementia prevention strategy. And then obviously we all know about memory, forgetfulness. So again, uh, we need to try and improve all these different neurocognitive domains. We've talked about this. Some experts feel that there is another domain where you avoid harmful substances like smoking, alcohol, even harmful habits like screen time. We talked about digital fasting, so you could make it even 8 domains. But every expert in lifestyle medicine would always include exercise. So, and there is now this science called, positive psychology science, and this is an acronym, PERMA plus. So, positive emotions, engagement, relationships, meaning, accomplishment, and plus is actually PLUS: physical activity, live optimistically, nutrition, and sleep. So again, the goal is that if we did this every day, did things that bring positive emotions, improve our engagement in activities that we truly can put our attention to, have supporting relationships, have meaning in our work, feel accomplished at the end of the day, stretch ourselves intellectually and physically. Again, physical activity, live optimistically, eat well, sleep well, then we will improve our wellness. So it could be emotional wellness, physical wellness. So going back to the topic, in the first session in January, we talked about 14 modifiable risk factors that were proposed by the Lancet Commission last year, and that if all these factors get eliminated, 45% of dementias will not happen. What does that mean? So on average, at least 10.5 million new people develop dementia every year. So if all these 14 modifiable risk factors, we take care of them this year, say 2025, then in 2026, instead of 10 million plus, we will have 45% less. So we will have 5.5 million. We would have avoided 4.5 million people would have avoided developing dementia. So now remember, this is just conceptual. All these interventions take years to take effect. And amongst these 14, physical inactivity is responsible for, say, 2%, which means that if everybody became physically active, then 2% out of 10 million, which is 200,000 people, will not develop dementia. And again, this is just a reminder of how uh, different risk factors act at different ages. But again, that doesn't mean that we can be physically active early on or later in life. No. This is just what research shows. Again, I'll take you through other research that shows that physical exercise can also help improve these other risk factors. So the overall effect of physical exercise may be much more than just this 2%. In the first session, we also talked about 3 other now established modifiable risk factors for future dementia proposed by the American Heart Association: atrial fibrillation, heart failure, coronary heart disease, and we'll talk about how exercise can address these also. All right, let's go one by one. So now we have good evidence that exercise can reduce low density lipoprotein, which, if it's high, is now a risk factor for future dementia. Now, again, it happens in 25% of the studies. So Obviously, there are other factors that will interact with exercise, like nutrition and stress management and genetics. But I would say, based on this, that everybody who has high LDL, we should share that physical exercise may reduce that number, and maybe combining aerobic with strength training. To me, even though there's no research, I would add balance and flexibility training also. We talked in the first session about prevention of depression, but all of us need to realize that if we ourselves have depression or our patients, then we should not just focus on, say, counseling or antidepressants. We should also talk about exercise being evidence-based intervention to treat depression. We have enough evidence for that. And this applies also to older adults, where if we prescribe structured exercise program that is tailored to their capacities, their strengths, their abilities, then the depression severity will be less. We don't realize the risks of antidepressants, and we underutilize the benefits of exercise to actually treat depression. Moving on to another risk factor for future dementia is untreated hypertension, high blood pressure for years. And again, physical exercise should be part of the overall treatment of hypertension, not just whether you're taking an antihypertensive or not. Again, exercise also has been shown to improve diabetes control, improve your blood sugar levels, and reduce the cardiovascular risk due to diabetes. Even a single bout of 30 minutes of, say, moderate exercise, aerobic exercise, and now we have very sophisticated tests that can detect all kinds of other biomarkers. So besides you feeling good, there are actually changes happening in your body, like changes in the insulin secretion pattern, uh, etc., that will over time dramatically improve your body's physical health and brain health, uh, besides just reducing the numbers that we look at for diabetes. Again, I've used the word clinical obesity because experts feel that we should change how we look at obesity. Obesity is primarily excessive body fat. So a lot of people with high body mass index may not have clinical obesity because they have high muscle mass and not body fat. So when we have high body fat, then regular exercise can help with not only reducing the weight, but actual fat loss and visceral fat loss, the fat that's in our belly around organs. And again, it can be benefits can be seen quickly, but many a times you require several months to see the benefit. Again, uh, aerobic exercise for 150 minutes at moderate to vigorous intensity is needed to achieve clinically significant results in body fat. So it's really hard to move the body fat out, but it's doable. Again, one has to really take this seriously because metabolically, body fat is very active and is causing all kinds of harms to us. Body, as well as the brain, is being harmed by chemicals released from our body fat. Moving on to the three places, the three cardiac conditions that we talked about that increase your risk of future depression, future dementia. So here it is. We have at uh, Saint St. Luke's lifestyle program where they provide cardiac rehabilitation. And if you join them, part of your rehab would be individual and group exercise program, which is now a core component of cardiac rehabilitation. So if you have coronary heart disease or heart failure, or you know someone, then please consider going for cardiac rehab. Uh, and again, there's research to show that exercise can not only reduce cardiovascular disease risk, but also in certain groups of people with cardiovascular disease, if they have depression, then the benefits of exercise are even more. So, and at least in this study, they had more sophisticated testing of neural activity of different brain areas. So amygdala, if it's firing too much, if it's overactive, and if your prefrontal cortex is, say, underactive, then that's not good, and that could be a factor in, say, depression or anxiety. And exercise can modulate the activities of these areas uh, in the brain. So now we have a mechanism that we can hang our hats on in terms of making real changes in the brain, not just our body, where the heart rate goes up, blood pressure goes up, and so forth. We'll have a whole separate session on stroke prevention that'll be done by our great physician assistant in our neurology department at Saint Al's uh, Memory Center. Uh, but again, all the guidelines talk about exercise being one of the key ways to prevent strokes. So primary prevention is when you've never had a stroke, and secondary prevention is if you had a stroke or you've had a transient ischemic attack. Uh, what about living long? Again, regular exercise is associated with lower risk of mortality at all age groups, but at higher age, the effect is even better. So again, you'll see a lot of these longevity conferences, and that's a lot of hype and waste of money that they'll get you to spend in doing all kinds of things that are not evidence-based. But I would go back to the tried and true vigorous exercise as a key way to stay healthy and live longer. Again, when we talk about dementia prevention, we have to also realize that there are certain populations, like individuals who have mild cognitive impairment, have a much higher risk of converting to dementia every year. Some say it's 15%, which means that if you had 100 people with mild cognitive impairment, by this time next year, 15 of them will now meet the criteria for dementia, meaning that their cognitive function has worsened. They've started having functional impairment. Their brain changes have changed. Now, if you go back and get them to engage in all kinds of lifestyle modifications that we talked about, but especially exercise, and even one session of vigorous exercise, 75 minutes, and there'll be reduced rates of conversion. So maybe it'll go down from 15 to say 10%. So then you've helped at least five out of 100 people not develop dementia next year. Again, a lot of research on Parkinson's disease, how strength training, aerobic exercise can not only improve the motor functioning, so the way they walk, their risk of falls will go down, but actually changes in the brain have now been documented. Uh, and so I would say that again, exercise is now a core component of Parkinson's disease treatment. Now, we talked about mortality, and that is in older adults and younger adults without dementia. But now we know that individuals with dementia can also live longer and healthier. And a lot of people say that maybe, they will suffer longer. I would say the opposite, that what you're doing is called something called morbidity compression. What does that mean? So if they were going to live for, say, after the diagnosis of dementia, say 8 years. So with exercise, they will not only say live for 9 years, but you'll see a morbidity compression. So instead of being disabled for the last 5 years, they'll be really disabled for the last 2 years. So again, we need to realize that uh, when we do all these things, exercise, nutrition, sleep, we achieve morbidity compression. So the amount of time we spent in disability is dramatically less. And now what do you do if You want to improve your cognitive performance. Again, moderate physical activity and your cognitive performance, which means that if I do all kinds of tests and check again later, say after a month, then you will do better in the test. Now, that is by just this one researcher. Now, obviously, uh, this applies to people who are having some physical health problems. So, as we age, we'll accumulate some kind of physical health problems: diabetes, hypertension, dyslipidemia, high LDL, low HDL, clinical obesity, depression, so forth. So, so in this population, exercise definitely helps. But uh, if you take healthy population, let's say you take my son who's in his 20s, and I put him on, he's very physically active, but let's say hypothetically he's not. Uh, and he starts doing moderate to vigorous physical activity, and I measure cognition, I may not see a demonstrable benefit. So, again, the more health problems you have, the more likely that exercise will provide you with much more returns for your investment. There are various mechanisms. I've just highlighted four, but again, it's important to realize that whenever we exercise, we increase cerebral blood flow, we reduce our inflammation, not only in the brain, but also in the body. The actual toxic proteins that cause dementia in Alzheimer's disease, amyloid and tau, we can, there is research to show that we'll even modulate how fast these proteins accumulate. And also will release all kinds of neurotrophins, neurotrophic factors. These are the factors that maybe released from the muscle, say, they pass the blood-brain barrier, they will increase synaptic strength, and that's where the memory resides. So your connection between the brain cells will be stronger, the life of the brain cells will be longer, and so forth. Uh, Again, we need, what exercise does is stresses us. So again, if you have heart disease, you'll need to get input from your primary care, your cardiologist, exercise physiologist, so forth, because it increases heart rate, uh, the amount of blood that is pumped goes up, amount of blood that goes to your skin and muscle goes up, your blood pressure also goes up besides heart rate. A lot of air goes in and out of your lungs. So there's a lot of physiology. And this is another core principle. We need to stress ourselves. So in this case, exercise. But in terms of nutrition, the example would be, say, fasting. In terms of cognition, you want to stress yourself, meaning that you engage in activities that are more challenging rather than things that you can do easily. If you do that, you will see your brain function improve. Now, how do we make this happen? So we know now that just giving you this knowledge, that is very unlikely that for most of you, some of you might change their lifestyle based on just this talk. So knowledge can influence a small group, but overall, that's not enough. Brief counseling by a primary care physician to actually tell you, listen, your goals are, I don't know, to be active, play golf, and spend time with your grandchildren until the age of 90. Well, that's not going to be uh, uh, possible uh, without really taking lifestyle and exercise uh, uh, seriously as part of your everyday life. Uh, that kind of individual counseling by the primary care physician. And sometimes we all need a coach who keeps us on the track. Hey, these are our goals. These goals support the goals of the goals, which is to live a long and meaningful life. Uh, so let's get back on track. Again, if you're doing it on your own, some people it might work, but for most of us, we need to surround ourselves with friends and family who are also into uh, living well and as healthy as is possible. And so when peers share their challenges, then it's that can influence our engagement in lifestyle modification like physical exercise. This is just basic knowledge that if if somebody is in the pre-contemplation stage, they haven't even thought about dementia prevention. Then you educate them, then say, you know what, yeah, let me think about it. And then they come back and say, doc, I've thought about it, and what's the next step? So they have finished contemplation stage, then say, all right, let's prepare you. We can't just start exercising. Let's make sure that your heart is good and what are your goals. So all that will come in preparation. And then they start with action, actually exercising based on the SMART goals. And once they achieve the goals, then we can't take the eye off the ball. So maintenance becomes important. So again, this is where we need to realize that motivational interviewing and getting somebody to really be motivated is where all the money is. Uh, Again, if currently you are not exercising, it's because you as a system are perfectly designed to not exercise. What does that mean? It means your lifestyle is not in keeping with exercising to the level that I shared. Your values might be different, where you value, say, intellectual uh, activity more than overall lifestyle activity, or that currently you have so much stress that that whole system is just focused on survival, not thriving and prevention. So again, if you need to have different results, there has to be a radical alteration in system. This is a good resource I would suggest. I recently read the new book also by Dan Heath that talks about how to change the systems. But in this case, uh, it talks more about how currently I'm appealing to your rational brain, the writer, but also now as part of the change, we will have to learn how to motivate the emotional mind to really make these big changes, because that's where it's going to be very, very slow. And then obviously you want to have a shape the path. Interpersonal and physical environment needs to be conducive. Currently, if we had great places to walk and walking was easy and we had beautiful places, we would be drawn out of our homes. This is another podcast I recommend. It's not strictly on exercise, but this is the future where we'll have biomarkers, blood-based biomarkers that will uh, be done uh, to see if you are at risk for Alzheimer's. We are not doing it now. We don't recommend it now. But unfortunately, it's available for people to do it on their own. So, so I recommend this podcast. And I'll be giving a talk on blood-based biomarkers in April at the ECHO program, Idaho ECHO program. So please consider attending that. Fourth Tuesday, 12 to 1. You'll have to sign up for it. Uh, Recommend our book at our Saint Alphonsus Memory Center, Improving Brain Health. It has a lot of information on SMART goals and motivational strategies and tools, and McCann's Brain Care Score that we have mentioned before. There are other resources to consider. Again, the reason I mentioned the book on long-term care is because it has a chapter on rational de-prescribing. Many a time we have medications that make the person weak or tired, so we need to de-prescribe them so that they can engage in exercise much better. And then even if you have dementia, if you exercise as part of your psychosocial spiritual care plan, your your life will be much, much better in all kinds of ways. And then again, as I said, mindfulness. So let me stop here and open it up for questions.